Most people don't look forward to getting vaccines, but they're an important part of keeping yourself and those around you healthy. From newborn through age 12, there's a series of required vaccines that have been proven very safe and highly effective in eliminating many diseases that used to cause significant illness and even death. These include diseases like diphtheria, measles, mumps, polio, and rubella. There are also seasonal vaccines for things like the flu and COVID-19 that people of all ages should get to protect themselves and those around them.
It sounds like most of the required vaccines are taken at the age of 12. Do teens and adults perhaps need to take these same said vaccines?
You're right. Most vaccines are given before age 12, and there are a few reasons teens and adults may require vaccines. There may be some shots recommended now that may not have been recommended when you were younger. If you're traveling out of the country, there may be required vaccines to protect you from diseases prevalent in the area you're traveling to. Then there's seasonal vaccines like flu and COVID-19, which are definitely recommended for teens and will protect you in cases of outbreak. Other vaccines recommended for kids starting at age 11 include meningococcal vaccines. Meningitis is a condition that can spread through casual contact and in places like dorms where people are living close together. HPV, a vaccine that protects against the human papillomavirus, a common virus which can cause several types of cancer or genital warts. Tdap, to protect against tetanus, diphtheria, and pertussis.
This seems like a lot to keep track of. How can we be up to date with our vaccines?
That's a great question. Vaccination records are maintained by healthcare providers and copies are available to patients. You can start by asking your parent or guardian if they have immunization records. If they don't have a copy, you can contact your pediatrician or past medical providers. The records may be available for download or can be picked up at the office.
Got it. What happens if some vaccines were not given? What happens if I need to catch up on some?
Another great question. It is not too late to catch up. If you are missing vaccines, you should schedule an appointment with your provider who will determine which vaccines you need based on your age and health and put together a plan for you.
To learn more about vaccines, you can visit the Center for Disease Control's vaccination guidelines online.